Supervisor Hopkins, we're now live.
Thank you. And thank you all so much for being here today. Before we get going, we'd like to start with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa sobre vacunas en el Condado de Sonoma. Esta sesión informativa es organizada por la Junta de Supervisores y se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Regresamos con Supervisor Linda Hopkins.
I am joined today by Supervisors Chris Corsi, David Rabbit, James Gore, and Susan Gorin, Drs. Mace and Baldwin, Carly Sullivan, Ken Tassif, Dr. Josh Weil from Kaiser, Dr. Chad Krilich from St. Joseph Health, Dr. Jason Cunningham of West County Health Centers, Judy Coffey, and Scott Ormerod from Leap Solutions. I'm Linda Hopkins, and I am going to start off by stating the obvious. We are in a pandemic. This is an extremely challenging time for our community, and I'm not always going to be able to give you good news. But I can promise to give you news and to continue the flow of information from our county, however imperfect the process may be. I also want to make you a personal promise. I'm going to call it like I see it. I'm not going to take a turd and try to sell y'all a chocolate cherry. These are hectic times and things are moving quickly, and that makes it all the more important for us to stop and give everyone an update on the progress that we're making in distributing vaccines here in Sonoma County, as well as the challenges that we're facing, and also an overview of the work we are doing in partnership with our local healthcare providers and other groups. First, I'll start with the good news side. I'd like to note that 23,787 immunizations have occurred to date here in Sonoma County. That is equal to nearly 6% of our total adult population. On the challenges side, I'm going to be honest. We just don't have the supply currently to meet the demand. You'll hear more on this later, but on the same week that the governor basically promised vaccines to anyone over the age of 65, which in our county is more than 100,000 people, he delivered us less than 4,000 doses of vaccine for the whole week. And some of that vaccine actually needed to be used for second doses from folks who had already received their first dose. In other words, we don't have anywhere close to what we need in order to vaccinate the residents at the speed that we want to. I've heard from a lot of you getting tons of feedback from constituents that other states are doing better than we are here in California. I can't disagree. Other states have taken a more centralized approach to appointment scheduling, to distribution, to data collection and information provision, which has greatly aided local jurisdictions like counties and local vaccination efforts. Here, we do have a long way to go, but I want you to let you know that our local vaccination effort is ramping up and we are kicking it into high gear. We plan to be ready to hit the ground running when more supply arrives. We now have 5 vaccination clinics in operation and 2 more large vaccination centers scheduled to be activated in the coming days. We're building towards a capacity that would allow us to vaccinate as many, if not more than 2,000 people a day. And this does not include those who are being vaccinated through hospitals and healthcare providers such as Kaiser, Sutter, and St. Joseph's, as well as our federally qualified health centers and CVS and Walgreens, which is responsible for vaccinations at skilled nursing facilities and residential care facilities. In a few minutes, our health staff will be going into more detail about where those vaccination sites are located and who they are for. We also will have this information available in the press release that we are sending out along with the updates that we'll be sharing with you today. The good news is that we're all working together to get these vaccines out as quickly and as safely as possible. But Sonoma County's ability to get vaccines in the arms of its residents is dependent upon 2 things. Number 1, the availability of the vaccines themselves. The speed of our vaccination effort is limited by the supply of vaccines that we have at our disposal. As we expand our opportunities, we are going to need more allocations from state and federal officials. Second, a successful rollout is going to require the full commitment of the community. This means all sectors, including healthcare, education, business, agriculture, labor, and nonprofit groups. Your involvement is going to be critical in areas including hosting vaccination clinics at community centers or places of employment, volunteering, and most of all, sharing accurate and timely information on what vaccination opportunities exist for family members, coworkers, friends, and neighbors. Finally, and this is the hardest one, and trust me, I've got a toddler, so I know, we do need a community commitment to being patient as we distribute vaccines in the most equitable way possible, making sure that those most vulnerable and most at risk are vaccinated first. We're going to continue to move quickly and safely through the different phases of the plan, but we are all going to need to be patient until it is our turn in line. With that, I would like to hand it over to Supervisor Chris Corsi to add some additional thoughts.
Thank you, Chair Hopkins. Glad everyone's joining us today. Thank you for being here. We know that good information is critical during this pandemic. It has been from the beginning. It's particularly important now through the vaccine rollout. But to be honest with you, we don't yet have all the info that we need and that you want. This is a work in progress. As we go through this, we're urging everyone in the community to use the county's website to get the information that we have as we get it. That's SonomaCountyEmergency.org/vaccine. This site is going to provide daily, or has been providing and will provide daily updates of the progress that the county as a whole is making in rolling out the vaccines. It also has valuable information about where vaccination clinics are located each week, who they're for, and how to get an appointment. It also provides information on when you can expect to be vaccinated and by whom. It's really important to know that the county is not going to vaccinate most people who receive a vaccination. If you have insurance, you're most likely to receive your vaccine from your primary care physician or your health provider, such as Kaiser or Sutter. But if you do not have insurance, there will be options available to you. We've now completed Tier 1 of Phase 1A, and we're working on to Tier 2, which includes home health care workers and those at primary care clinics and federally qualified health centers. We're also working on Tier 3, which includes specialty clinics, laboratory workers, dental clinics, and pharmacy staff. But we're still early in the effort, still in Phase 1. This is going to take time. Finally, as we work through that time till we get to everybody's arms here, SonomaCountyEmergency.org/vaccine has answers to a lot of the community's most common questions and information such as vaccine myths and misconceptions and ensuring vaccine safety. There's a button on that or a link on that page. When do I get my vaccine? At this point, I'll hand it over to Supervisor David Rabbit.
Thank you, Supervisor Corsi. I appreciate that. Well, in the spirit of President Biden, I think as our chair led off, we're going to tell you like it is, right down to the good, bad, and the ugly. I think for the last 10 months, the state has sent some very confusing messages, to say the least. And that's continued with the vaccine rollout, including who is going to be vaccinated and when. Especially true for those over 65. And as our chair mentioned, the number of Sonoma County inhabitants over 65 is about 102,000. 4,000 vaccines that week is not going to take care of that, that particular amount of people. The county and our local healthcare providers are working to get vaccines into everyone. But again, it is a supply and demand issue that we're dealing with. 102,000 people who are over 65, and the supply is so limited. That will build up over time, we hope, and within some weeks, we will continue down that path. One priority is Phase 1A, including residents and staff in our skilled nursing facilities and residential care facilities to make sure that they are vaccinated. This is being overseen by the Federal Pharmacy Partnership for Long-Term Care program with CVS and Walgreens. That too has been frustratingly very slow. Our health team has reached out to all 22 skilled nursing facilities in our community. And of the 16 that have responded, 14 have reported receiving at least their first doses of vaccine. And overall, about 2/3 of the staff at these facilities have received their first dose, while roughly 10% have received 2 doses. Our public health staff, in partnership with Kaiser Permanente, will be supplementing the federal response to reach residential care facilities in our community. And Dr. Mace and the health team will explain that more in a moment. And that's to try to speed up that process that has been going slower than we would like. We know this is a difficult time for everyone, including business owners, especially those that have been shut down and have not been able to earn a living. We encourage business owners to go to the Sonoma County Economic Development Board website. That's sonomaedb.org. And in partnership with the County of Sonoma and the Department of Health Services, the EDB has compiled a list of local, state, and government resources and benefits available for businesses and employees who have been affected by the pandemic and the economic shutdown. There also is valuable information on socoemergency.org's novel coronavirus pages about testing opportunities, isolation and quarantine instructions, as well as help and resources available to those facing hardship due to COVID-19. We also remain hopeful of receiving more assistance, as President Biden has promised in a relief bill that includes roughly about $440 billion to support state and local governments in their battles against COVID-19. And as those programs roll out, make sure that you do come back and visit our Sonoma County EDB website for updates. With that, I will turn it over to my colleague, Supervisor James Gore.
Thank you, Supervisor Rabbit and everybody else. I'm going to go through two things quickly. One is a statewide perspective for us as counties, and the second is here locally, our equity portfolio and how we ensure equitable access and distribution of the vaccines. The first thing is that I have a different role. Also, in addition to being a Sonoma County Supervisor, I am the president of the California State Association of Counties. There's 58 counties throughout this great state, and there's 58 different stories about how vaccines are being distributed on the ground. We're hearing a lot of stories from different counties and from our constituents that might say, hey, in Riverside, they're doing this, in Marin, they're doing this. This is what I hear in Santa Clara and San Mateo. I want to stress that a lot of that is really dictated on local conditions. San Mateo, Santa Clara, quite a few of the others, they run direct services to constituents. They have county hospitals, they have county health plans that go out to people directly. Whereas here in Sonoma County, we are really a facilitator and administrative lead of vaccine distribution. We are not in the business of direct patient care here. The vaccines that do come into our county do go out to our health clinics around the county, folks like Santa Rosa Community Health, Alliance Medical Center, and the other ones up and down our county, Sonoma County and Indian Health Project, all of these. But really our goal as a county is to track what's coming in, get clarity from the state on what that is, and then track what's going into people's arms so that we can support the state's goals. One thing to be clear on too is that our early notice through the state and in our collaboration is that the Biden administration will continue to outlay vaccines based on the effectiveness of getting those vaccines into people, not on per capita basis. The state was fighting for that, 40 million people here in this great state. Give us the vaccines and we'll get them out. But the state is going to continue to do it based on this other model, which is how adept you are at getting them into people's arms. So with that being said, there's a lot of work here, and some of you have seen some news recently, even as much as today, about our organization, the California State Association of Counties, the California Health Officers Association, and others saying what we need out of the state to be able to fix this data crunch so that we're effective. So the state gets what it needs to be able to request more vaccinations. We're able to track them locally, and we're able to achieve progress. Outside of that, I want to go into our commitment to equity. We've done this throughout a variety of things over the past year. We created an Office of Equity, unanimously supported by this Board of Supervisors. We have a Latinx task force that focuses on the testing and COVID outreach. We have allocated dollars to the Cura Project, which provides money directly and emergency financial assistance into the hands of people who contract COVID. And as a board, we are also deliberating this coming Tuesday enhanced allocations of funding going into the community to support those harmed most by this pandemic. One thing we need to keep our eyes on is at this state and county level is how our current tier system is set up. A lot of people are still asking us not just about vaccines, but about reopening aspects of our economy. in addition to the tier system that's already there. I think we can anticipate there's going to be some heavy negotiations between counties and the governor's office on whether or not vaccine deployment will create a new trigger for opening aspects of our economy. If we protect the most vulnerable in our community, how do we also allow low-risk activities to get back to work? That's all I have for right now, and I want to pass it over to Supervisor Gorin, and thank you all for joining us.
Thank you all so much for joining us this afternoon. And I really need to thank my colleagues on the Board of Supervisors, all of our amazing healthcare professionals in the county and throughout the county. We are scrambling, as you've heard my colleagues suggest, to try to set up a distribution system for vaccines that make sense, respond to the need, and really adequately supply adequately advocate for the supply of vaccines. Thank you to so many who've outreached to us. As a senior over the age of 65, no, I haven't received my vaccine either. And I encourage you to be patient. Our supplies are limited. We are setting up vaccine distribution sites and identifying qualified personnel to help in that regard. But we really can't do that until we have adequate vaccine supplies. So please be patient. We're, as you've heard from my colleagues, patience is the word right now. It's taken us a long time over the last 9 months to gear up to approach the COVID pandemic with the seriousness that it deserves. It will take us a while longer to ensure that all of the vaccine doses are received in the county by the county and our healthcare partners to ensure that you are vaccinated. But while that happens over the next few months and you are patient, please observe our stay-at-home orders in order to be safe and keep the safety of your families and your coworkers. And it's important to remember that we're still under the stay-at-home order. And it won't be lifted until the 4-week projections of our ICU capacity for the entire Bay Area region goes above 15%. When that happens, is anybody's guess. Most likely the Bay Area ICU capacity is less than 7% now. So we have a ways to go. And we know that we have significant surging happening and a number of record cases identified locally and throughout the state. So again, we need to remind you and everyone to be patient and remain vigilant. Please wear your facial coverings and follow the safety protocols. And remember that even after you receive the vaccine, you will still need to wear a mask. That's because until we develop a herd immunity in our community, there is still a chance that you can spread the virus to those who have yet to be vaccinated. Given that our cases of COVID have been surging and our vaccine supply is limited, we have to remain vigilant. We understand how frustrated you are, how weary you are of sheltering in place, how much you want to see your friends and family and feel safe working out in the community. But if we don't follow these safety protocols, we run the risk of allowing the chain of transmission to continue, thus enabling the virus to reach someone who is older and has underlying conditions. If you continue to mask up and limit your physical interactions with the non-household members, we can minimize the worst outcomes until the vaccines become more widely available to you and me. Finally, we want to thank all of those who have offered to support this effort. If you are a licensed healthcare professional, please sign up for socoemergency.org/vaccine volunteers, because we are going to need your help to volunteer at our clinics that we're going to be announcing and setting up as we speak. And so now I'll turn it back to Chair Hopkins, and thank you to everyone for your patience in guiding us through the next phase of this pandemic.
Thank you so much, Supervisor Gorin. I'm actually going to be turning it over to Dr. Sundari Mace, our health officer, as well as Dr. Kismet Baldwin, our deputy health officer. And they will also be joined by Ken Tassif, our vaccine mission manager. And they're all going to be going over in more detail some of the things that we just summarized.
Yes, thank you so much, Supervisor Hopkins, as well as all the other supervisors and other panelists. And thank you, everybody, for joining us today. I'm going to go over a few slides first, so let me share my screen. Are you able to see the slides right now?
We
Yes.
are.
Yeah, we can
Okay,
see
and
it.
they're in the right format.
Yes.
Yes, they're all
Indeed.
presented.
Thank you very much. So we are very busy here at the County Health Department, along with all of our healthcare partners, getting the vaccine out to the community. I wanted to show you our vaccine administration over time. I think it's already been pointed out that the rate limiting factor for getting vaccine into arms is really going to be the supply of vaccine that's given to us. As several of our supervisors have already noted, even just our population of 65 and over is about 102,000 persons. That is close to 20% of, a little over 20% of the total population of Sonoma County. And it's an even greater proportion of those that are eligible to eventually receive the vaccine. So if you take a look, we're very happy to say that we have gotten 23,787 doses administered, and that number is increasing over time. And as you can see, a good proportion, about 5,000 people have been fully vaccinated with 2 doses, and the rest will be getting their second dose in a timely fashion when they're due. Oh, and before I go onwards, I just wanted to say that the quarantined doses of Moderna vaccine, of which we had 7,500 doses, have now been okayed to give. And so that is not a worry any longer. And I want to quell any fears in the community about taking either vaccine, either Pfizer or Moderna. They're both safe and have great efficacy. This is the vaccine distribution strategy that has been set forth by the California Department of Public Health. And we are following that prioritization to really reach our most at-risk and vulnerable populations first. We have pretty much completed phase 1A tier 1 and are well through tiers 2 and 3, and are moving now with our hospital partners into phase 1B tier 1, specifically in those adults that are 65 and older. Public health here in Sonoma County coordinates, supports vaccine distribution with our healthcare partners. We are not giving vaccine directly, as we don't have clinics and we don't provide patient care, but with our vast group of healthcare partners, we're getting the vaccine out. I'm happy to say that we are making progress with our most vulnerable population. These folks in the skilled nursing facilities and the residential care facilities for the elderly are in phase 1A tier 1. CVS and Walgreens have been reaching out and vaccinating this vulnerable population through a federal program whereby they receive vaccine directly from the federal government and then in turn schedule and ensure that residents and staff in these vulnerable settings are vaccinated. Of the 22 skilled nursing facilities here in Sonoma County, 16 responded to a recent survey. 14 of the 16 facilities have reported receiving at least their first dose of vaccine. And a smaller percentage, 10%, were fully vaccinated within 2 doses. And that's mainly because the rest are scheduled for their second doses here in the next few weeks. And as you can see, about 2/3 of the staff had received their first dose. 685 residents received their first dose. And about 20% of those were fully vaccinated with 2 doses. This is an ongoing process through CVS and Walgreens. We have schedules that they've set up. However, we realize that this is a group we really need to get to and get to quickly. So we are now partnering with Kaiser as well as home health agencies to go out and supplement this response to ensure that residential care facilities for the elderly that have fallen through the cracks or are late in the schedule or currently have outbreaks of COVID are going to be reached sooner by our partnership, again, with Kaiser and Home Health Agency. So you will be hearing more about that. As far as the hospital staff that are also part of phase 1A tier 1, 44% of them have now had 2 doses, and the rest are on the schedule for getting that second dose in the next couple of weeks here. Just means they haven't quite reached the time when they need their second dose. So our hospitals have done a fabulous job vaccinating their staff, as have other healthcare professional organizations. The federally qualified health centers, solo practices, other medical groups, specialty groups, urgent cares, all are have vaccinated their staff with either 1 or 2 doses at this point. And they're in tiers 2 and 3. Looking at vaccine operations that the county is coordinating, we have, maybe what I'll do actually is, Ken, do you want to go over this slide?
Yes, I'd be happy to. Thank you very much, Dr. Mace. So we, as the supervisors mentioned, we're not doing direct administration of the vaccinations, but we are doing support of those that are administering the vaccination. In talking to our healthcare partners, one of the things that we found from them is that they need space and infrastructure to help them with this effort. And so we've begun to open up centers, vaccine centers that provide the furniture, the space, and the supporting staff to help them do their job. We've got centers at Grace Pavilion that is open and operating. The fitness center at Santa Rosa JC Petaluma campus, the infrastructure set up, and they should be opening next week with a partner going in. Huerta Gym at Town of Windsor, we're finishing up our contracts with the town, and we should be putting infrastructure in place there. The public health lab at Chenet Road, we have been doing vaccinations there for several weeks now. At the county administration building, we're doing several, are doing drive-up and walk-up clinics. We also are in the process of locating a site in Sonoma County, Sonoma Valley, to place a center, and we also have a site operating on a regular basis at the Roseland Library. So we have a whole bunch of different locations in various areas of the county. We took equity and access considerations into account when citing these places, and we believe that we can do over 2,000 vaccines a day out of these locations. The county is acting essentially as the property manager, and the providers will come in and do their things, but we will be providing supervision. We will provide traffic control, greeters, interpreters, and security at the sites to support their work there. In addition to the vaccination centers, we are also putting together packages to help providers get on a state software system that allows them to do scheduling and let that scheduling go into an intake system as people arrive, and then use that intake system to automatically upload data to the state immunization registry, which will make the process, the administrative process much more efficient. We have people that will be helping our administrators, our providers enroll in the for the software and to be able to handle the vaccine. The vaccine is a complex vaccine to handle, and therefore we have people that are trained to help the vaccine administrators be sure that they handle it properly, that there's integrity to the use of the vaccine. And then we also have a volunteer coordinator that will help take those individuals that are interested in helping our medical partners with doing vaccines, and we'll connect them with the medical partners that have requested the help. And so we're doing a great deal of effort in making sure that our partners have what they need to be efficient in what they do best.
Great, thank you very much, Ken. So efforts are ramping up, and we will keep you posted as more and more people get vaccinated at these different sites through our healthcare partners. So I'll go ahead and end the show at this time and stop sharing.
Thank you so much, Dr. Mace, for that presentation. I appreciate it. Next, I'd like to invite our healthcare partners to share their updates on the vaccination rollout. Dr. Weil from Kaiser, I'm wondering if you might share how things are going with your entity.
Sure. Thank you very much for inviting me to participate today. And welcome to everyone else. At Kaiser, we have been moving forward with our vaccine plan, and we are now prepared, as there is sufficient supply, to expand to a second site that will mirror our program on our main campus. So we'll have the capacity to have 2 simultaneous sites, and we'll be providing immunizations 5 days a week fully, and then also have some vaccines available on the weekends as well. So again, that is when there is sufficient supply to begin that, but we've been using this time with the early vaccines of healthcare workers and the Tier 1A participants to really refine our processes and make sure that we have all the pieces in place. And we are also partnering with the county routinely on making sure that other people in Tier 1A and those vulnerable populations, as been mentioned in the long-term care facilities, that we are gearing up to help in those venues as well. So I think it's important for everybody to remember that all these plans that we have, whether it's in the community clinics, whether it's in the hospitals, these are all sites that have a responsibility to continue performing the medical care that we do every day, whether it's managing diabetes or hypertension or asthma in the clinics, or pediatric immunizations, well, child checks, or whether it's managing strokes and heart attacks and lacerations in the hospitals. That work continues to go on every day. And so this has to be an effort where we can achieve both of these outcomes, both continuing to maintain and deliver the healthcare for our community and to ramp up to provide the vaccines that we all need. So it's taken a lot of coordination, and we're pleased with how it's gone so far, and we are fully prepared to continue partnering with the county and making sure we can get this job done.
Thank you so much, Dr. Weil. And I believe that Dr. Chad Krilich is here to provide an update from St. Joseph Health. So I'll hand it over to you.
Great. Thank you for the invitation. My name is Dr. Chad Krilich, and I am the Chief Medical Officer supporting Santa Rosa Memorial Hospital and Petaluma Valley Hospital as a part of St. Joseph Health. And I think, as Dr. Weil mentioned, right, we continue to provide care over the course of the pandemic as a regional referral center, and also the primary care that we provide for patients in the area. That being said, there's been a lot of really good discussion about, where do we stand on vaccinating all of our caregivers and all of the folks within Sonoma County, because we know that that is our way out of the pandemic. And so to that end, in the spirit of what's already been said, there's some good news, and then there's some news that just says where we actually are in the process. And I'll start with the good. So the good news for the folks who work at St. Joseph Health and who hold contracts with us and provide patient care is that our vaccination process is open to all of our caregivers. We've completed over 1,000 vaccinations that includes both the first and the second dose is for either Pfizer or Moderna. And we've administered over 3,500 doses for all of those people who work within our organization. In addition to that, we are forecasting that we'll probably be done with our first dose clinics for those caregivers that work within our organization by the second week of February, which is an important transition for us to be able to focus on vaccinating our patients. New employees will still be eligible and available to receive vaccines through our caregiver health organization. So that process will continue, but it'll continue down a path that we would normally use, say like we use for vaccinating for influenza. But that brings us to the bigger task that's ahead of us, and that's vaccinating our patients. And that's our patients within our primary care clinics through St. Joseph Health Medical Group. And if we were to look at the current supply that we have today and the number of patients that we need to vaccinate over the age of 65, we have 4% of the vaccine supply that we would need to vaccinate all those patients at once. And so to that end, it's true that we don't have the supply of vaccine that we need today to do that. That being said, we are very much looking forward to more transparency around the supply chain as it relates to the management of administering vaccine. And so we're very eager to see what that looks like. That being said, with the limited supply of vaccine that we do have, we are going to start vaccinating our patients over the age of 65 next week. We've reached out to our patients to help them to understand the process by which they can do that. And I'll just close by saying that at St. Joseph Health, we also, part of our mission is caring for the poor and vulnerable. And when we look at the process that's created around vaccinations, it does create some gaps. And that's something that we're very much looking forward to partnering on to see what we can do to make sure that everyone within Sonoma County gets vaccinated.
Thank you so much, Dr. Krilich. And now I'd like to introduce Dr. Jason Cunningham from West County Health Centers.
Thank you, Supervisor Hopkins. I actually really want to just call out the leadership that I'm seeing and the transition for a new administration. I think for all of us to recognize that leadership really includes being transparent and authentic in what we're talking about. This is complex, and it's okay for us to talk about the complexities. It's okay for us to encourage our community to understand the barriers that we're receiving. I think that allows us to have unique partnerships. And so I'm really appreciating the guidance here that we're receiving. And as we're just hearing, there's some major issues that we're dealing with. And some of those are issues that we inherently have to figure out in Sonoma County. And some of those we have to lean on others at the state and federal level to work. And that's leadership. That's figuring out how to advocate and have an ethics lens or an equity lens. I'm part of a larger group of health system leaders trying to figure out kind of a solution, including those participating in the county. And I would say one thing that I would want to encourage is I'm seeing real, authentic, rolling up your sleeves, trying to figure out the solutions here. And I'm really thankful for that. So I just want to give people reassurance that there's a lot of work being done right now to try to figure out a way forward that meets the needs of our communities. And they're just not easy answers. And so the area that I'd like to highlight is what Dr. Krilich was talking about, is that when we're setting up our system in such a way that we're allowing the health systems to vaccinate, which is the reality of Dr. Mason and all of the supervisors are talking about, that's our system of care in Sonoma County. That's not because that's something that we're doing just because of the pandemic. That's what we have inherently, which creates a problem with disparities. So when those who are not connected to the health system don't have a direct access, either because they don't have a primary care provider, they don't have insurance, they don't feel comfortable accessing the system, then you create a systemic issue where those who want to get vaccinated can't get vaccinated, even if they fit into that sector. And that's a really important problem. And so when you look at from an ethics or an equity lens, that's where we have to kind of lean in together. And so I would say from an encouragement perspective, that's going to require all of the health systems to put in together a tithe, if you will, or a commitment to the community as a whole in order for us to vaccinate. So as Ken was talking about, just that structure being set up, the leadership being set up, the infrastructure, we need to then take that on from an equity lens. What does that look like from an access? What does that look like from certain populations who don't need to happen? And it can't just be taken over by our health systems who are having existing structures. So I'm really thankful for leadership that I'm seeing in a really important way with lots of phone calls. I've been on lots of those phone calls with many of you at late night trying to figure this out. What we need to do from an equity perspective is to think about not just health system access, but community population health access. And so we can't talk about messaging and communication to populations until we can say, and this is how you're going to get vaccinated when you want to get vaccinated. So that's where I'm putting most of my energy, is to helping understand and figure out and lead what does it look like together for us to figure out those solutions. And it's going to look something like us participating in those larger lanes to vaccinate for community. I know the Kaiser, Sutter, and the Providence health systems have all agreed to partner with the community health centers and the county to participate together in some of these community efforts. What that looks like, how do we schedule, what is the timing of that is to come, but I'm encouraged by that overall. So thank you.
Thank you so much, Dr. Cunningham, for your work as well as your perspective. And our last panelist today, I'm going to hand it over to Judy Coffey to provide a brief update on Leap Solutions' work with the Vaccination Stakeholder Outreach Campaign. And then after Judy, we'll be turning it over to a question and answer session moderated by Paul. Judy, mic is yours.
Thank you, Supervisor Hopkins and everyone else on the meeting here. Leap Solutions Group has already held 2 well-attended stakeholder engagement meetings. We are planning another one for next week. In addition, we are convening an outreach committee looking for individuals who can represent their sector or their industry. We will gather information, establish a communication flow using the hub and spoke concept. We continue to work very closely with the county and to develop communication materials for the outreach committee who will be able to share with their contacts. As you've heard everyone else speak today, in light of the very low vaccine allotment here in the county, Leap Solutions continues to be the voice of understanding and patience. And if you need to reach us, we are at outreach@leapsolutions.com. Thank you.
Well, thank you all. Really appreciate it. We'll turn to some questions from our media partners at this point. As usual, we invite, if you have a question, to go ahead and raise your hand and we can, I'll call on you to ask it. We had a few of our reporters ask questions in advance. And I think we'll start with a couple of those. Jill Tucker from the San Francisco Chronicle asked about questions about whether we have started vaccinating any groups in 1B tier 1 category, and if not, if the plan is once we get there, will we be focusing more on those who are over 65 ahead of other groups like teachers? Very good question. A number of people are interested in that. Dr. Mace, do you want to take that on first?
Yes, thank you, Paul. So we had gone to phase 1B tier 1, primarily at people looking for people 65 and older. I know that our larger healthcare systems, our MCEs, Kaiser and Sutter, had definitely started vaccinating that group of people. We also went forward with some of our emergency responders that are in phase 1B tier 1 as well, law enforcement, for example. However, in light of the new prioritization that the state of California is discussing in terms of a much more age-based prioritization based on vulnerability for bad outcomes, we are also pivoting towards really focusing on those age 75 and older. Those also, I think we will go ahead with 65 and older because it is very difficult to determine who has underlying medical conditions. Therefore, that's going to be our focus. We fully realize that teachers and other staff and schools are a high priority moving forward. And we've already put out a call for all teachers 65 and older to get vaccinated ASAP in the next week or two here through our Sonoma County Office of Education process.
Dr. Mace, do you want to talk about that a little more? I'm not sure. I know there's been a lot of discussion at the state level of shifting to an even more focus on the age-based tiers. Would you talk a little bit more about that for those who may not know what you're referring to?
Yeah, so what we had been doing is just going through phase 1A, tier 1, 2, and 3, and then getting into phase 1B, which actually includes a large portion of our essential workforce. That would be like agricultural and farm workers, in addition to everybody in education. That would be in public school, private school, childcare. That was, all those people are in phase 1B, tier 1. However, now with a new focus on the most vulnerable populations and getting the vaccine to those people first, even within those groups of people in phase 1B, we're going to prioritize based on age. So we would look at those who are 65 and older in those specific categories first before moving on.
Great, thank you very much. Phil Barber from the Press Democrat also had some questions. He asks about our vaccine supply. He would like to know how many vaccines did we receive this week, and do we have a total on doses that the county has received thus far?
Yeah, so this is a bit of a moving target. As everybody knows, we get doses weekly that we're informed about a few days before or the week before we get the doses. Doses come directly to public health, and doses go directly to the hospital systems as well. And then they are administered or allocated for administration by our healthcare partners. So it's sort of a moving target of, you know, doses in, doses out that changes on a daily basis. And our team is working really hard in ensuring that doses are either administered or allocated to our healthcare partners to get them out. As far as how many doses we received this past week, I think, Paul, that who on this call would know exactly the number that we received?
I think I have the number, and Ken, maybe you could, if I got it right, I think it's 5,925 that we received this week and that's strictly for the county, correct?
That's correct, yes.
For the county public health. So, okay. Let's go to Martin Espinoza. Martin?
Just to follow up on Phil's question, we do have some hospital officials here on this call. Can they give us a sense of what they've received this week in terms of doses directly?
Well, this is Josh Weil from Kaiser, and I'll just, you know, just for context, Kaiser Permanente, California, has 1.5 million members over the age of 65 and older, and we received, and again, we receive as a hospital system, and then they distribute to amongst all the hospitals in the system, including Northern California, Southern California, and we received 20,000 first doses and 20,000 second doses last week. So 40,000 total, and we're looking at that population over 1.5 million. And again, that's across our system.
Anybody else? So we don't, I mean, I think what Phil was hoping to get is just a sense of the county as a whole, how many doses are coming in and how many have been distributed. We talk about, I mean, with all due respect, we talk about transparency, and that's, I think, a fundamental thing that a lot of people want to know. And is anybody keeping track of that?
I don't know if we want Carly Sullivan on the call.
Yeah, I don't know if Carly is on. We're tracking that. We at the county level don't have a clear picture until we get the information from our hospital partners and how many doses they each receive. So we're using a system through Image Trend to try to collect that information from our hospital partners and also from the skilled nursing facilities to find out how many doses have been administered there. So that's how we're finding this out, because you know, there's multiple different sources that are receiving vaccine. And so it's that's why it's a little difficult for us to give a grand total, because there's many moving pieces here. But we are working towards getting that number and getting that out.
And Martin, if I might add, we are going to be building that into our dashboard once we get those. It's sort of like the challenges we faced in getting ICU capacity numbers, just trying to get all of them straight, and we are trying to get information as to how many are coming through CVS and Walgreens as well.
I hope I didn't waste my question. I did want to ask something about,
go ahead.
About our skilled nursing facilities and our residential care facilities and the vaccination, the federal partnership program that is taking place there. And I know that the county has sort of been paying attention to that process and the scheduling that's taking place. I did have a chance to look at a schedule of vaccination dates for all the facilities in the state, skilled nursing and residential care. And I narrowed it down to Sonoma County, and it looks like, you know, it's a very slow process. And I'm hoping that you know, at this point, and this was as of the 19th of January, but it looks like some of these facilities, if we keep going at this rate, are not going to get scheduled until later, you know, possibly June or May. I'm wondering if the county has gotten involved in this process, or is trying to speed up that process, or maybe pull some of those people out of that federal program to get them vaccinated sooner. At this point, I'll be vaccinated before a skilled nursing facility, not a skilled nursing, but a residential care facility resident will be vaccinated.
Yeah, we share that concern, and that's why we are now partnering with Kaiser and one, if not more, home health care agencies that provide, usually provide in-home care. Cheryl Fox and Associates is the one that currently we're contracted with to go in. So what we've done is we've identified first the residential care facilities that are not on a list. They're not even on the CVS or Walgreens list for whatever reason, and targeted them. We're also looking at the ones that currently have outbreaks to try to speed up the process there and get as many people vaccinated as possible, staff and residents. And when we go out, we will do both staff and residents. And then lastly, we're looking at the facilities that are scheduled further out. So we certainly hope that June is not going to be when they're scheduled. We're looking at ones that are even scheduled later in February to go to before CVS and Walgreens get there. So that's part of our plan right now, and hopefully pretty rapidly we can get these residential care facilities taken care of.
Paul, I would like to write about this involvement that the county is in. We can talk about that later.
Okay, sounds good. Let's go to Daisy Carreno. Daisy? Daisy?
I think she submitted a couple of questions in the chat.
Did she? Okay. Well, let me go to, we have a couple of questions from Univision. Let me start with one. They ask, are you tracking who is getting the vaccine in terms of race? And if not, how are we making sure that we know who got the vaccines in terms of equity?
Let me send the tracking question over to our lead of epidemiology team. That's Kate Pack.
Hi, yes, the Immunization Registry, where all the vaccine data is recorded, does record demographics for everyone who receives a vaccine, and that includes gender, race, ethnicity, and we'll also be able to look at geography.
And is that the same registry that all of our healthcare partners, healthcare providers are using as well?
Yes, anyone who is administered the vaccine, any resident, their data will eventually end up in the care system. The only exception to that is the federally administered doses to the SNFs and RCFEs through CVS and Walgreens, but all other providers enter their data into the care system.
Okay. Well, a follow-up question. Our friends from Univision asked, they said, we have heard from local community clinics that that these are clinics that serve largely Latinx communities, that they don't have enough vaccines and that they don't know when they are going to get more vaccines. Do we have an idea of how we're going to be able to support them in getting the vaccinations they need? The vaccines. Dr. Mace, do you want to address that, or maybe one of our healthcare partners?
Yeah, from our side, we are distributing vaccine to those entities that are then providing vaccine to their patients or their clients. I don't know, Ken, if you wanted to add anything, or if anybody else from the clinic side wanted to add.
Yes, we continue to have daily discussions with our healthcare partners to determine where who is conducting the various clinics and when they need the vaccine, and we're distributing based on those discussions.
Maybe I can add too, just as a CEO out of a community health center, I think that we're all in the same boat here. It's a distribution problem. And so I think the question is, can we get enough vaccines for our patients? And then broadly, I think that I come from an organization that's been in our community for 40 years. There's an equity lens of, can our communities get enough vaccine, not just our patients? And so those who can't have access, those who can't get to the one-on-one corridor, those who aren't wanting to go to the government organizations to get that. And I think that's a heart for the community health centers as part of what we serve. We don't have enough vaccines to get that. So I think we're all in the same boat. All the health systems are, it's a distribution issue. So as we work together to figure out how to get to the residents, it's going to be a problem of when can we get enough vaccines. So I would say that that's a general problem for all of us.
And just to clarify, so the vaccines that go to our FQHCs, the federally qualified health centers, those are coming from the portion of the vaccines that come to the county, correct, Ken?
Yeah, we work directly with
correct.
Ken and his crew every week to get a distribution and how much we can administer. And then it really depends on how much we can administer and how much there are to receive.
So my point being that that too is limited by how many we receive. And if we only get 5,000 for the whole county, just a portion that goes to those clinics themselves. So let me go back to Phil Barber. I think he had a follow-up. Phil?
Yep. Paul, can you hear me?
Yeah, you're on.
Great, thank you. This is sort of getting back to the supply question. I understand what Dr. Mace is saying about the difficulty in counting every dose received, but I'm wondering, do you have an estimate or a ballpark at the percentage of doses that are going into arms? We know that at the state level, and the state's doing very poorly compared to other states. I think it's less than 40%. Do you have an idea of what that number is in Sonoma County?
So we're working on getting that exact accurate information. We need to also take into account that there's some sort of mixed messaging so far about how many doses to hold back for the second dose for people, whether we're doing that or not. We're clarifying that with the state as well, because that's going to impact the denominator and the percentage. And we want to make sure that we're doing all this quite accurately. So Phil, we will be getting that information to you as soon as we have the best way that we can accurately give that information. And we're working on it and get that to you soon.
Appreciate that. Not knowing what that number is, and I understand that sort of changes the complexion of this question, but assuming it's, somewhere around 50%, 60%, obviously better than the state, still that's less than the 100% that a lot of anxious residents would love to see. Is what you just said about holding on to some for second doses, would that explain most of or some of the gap between what we're delivering and, that 100% mark that would be ideal?
Well, that would certainly impact the percentage if the doses that you're holding and not giving out are in the denominator. So the question is, how is that being calculated? And we want to make sure that we're aligned with the way that generally this calculation is occurring. The other point is that even though, the vaccine isn't getting into the arms, they're allocated. So there's a clinic coming up, in the next few days, and we've allocated 600 or 1,000 or whatever doses specifically for that. So I think it's important that we have a very systematic, aligned way of calculating this. And that's exactly what we're working on doing.
Thank you very much.
Okay, let's go to Susan Walbarst. Susan?
Hi, I've asked this question before, but I haven't gotten a very definitive answer. The question is, will Sonoma County give some of its vaccine doses to Mendocino County to compensate for all the people on the coast in places like the Sea Ranch, Stewart's Point, Annapolis, Timber Cove, who are being vaccinated in Wallala at the Redwood Medical Services?
Yeah, actually, we had a call about that, and I think someone here has an update on it. Either Dr. Baldwin or Carly Sullivan will have an update on that.
Hi, yes, Carly Sullivan, EMS. We did have a very successful meeting this afternoon with our CMS and are coordinating getting them some additional vaccinations to support those communities.
Do you have any details about that?
And yes, in relationship to details, they'll be receiving both a Mendocino allocation and a Sonoma County allocation of vaccinations, and that'll be coordinated through the traditional MOAC channels.
Okay.
Okay, thank you. And let's we're past the top of the hour, and I want to be respectful of everybody's time. But Martin, did you have a follow-up?
I did. I'm doing a story. I would normally ask you guys about this tomorrow, but it's a weekend story about enforcement and compliance. We have this an unprecedented surge. January's already become the deadliest month here in the pandemic, and I'm just hoping to get a sense of whether or not, based on the number of complaints that are coming in through the tip line, whether or not we're seeing compliance with our public health order. Are we getting more or fewer complaints now compared to, say, a month ago or 2 months ago before the surge? Is there any way of judging how the public is responding to compliance to the health order?
Well, unfortunately, we don't have anybody from code enforcement on the panel today. We're focusing mainly on vaccines today. But I think by virtue of our hospitalizations are stabilizing, but our cases are still very high. We can sort of use that as an indication of how people have responded. Dr. Mays, do you have any other thoughts on that?
No, I think we need to get some of the data from code enforcement, because I don't know where we're tracking the number of calls coming in, if they've gone up or stayed stable over the course of the past month.
Yeah, we've been fairly stable last I heard. Go ahead, Supervisor Gorin.
Thank you, Martin. It's a good question, and I would encourage you and echo Paul's comment. Please outreach to code enforcement. Great code enforcement efforts on vacation rental owners in Sonoma Valley. We're getting ready to issue some significant fines for illegal rental activity, so contact them.
Again, I think this might be a good time for me to reinforce that although we have vaccine and we're vaccinating as many people as possible, as quickly as possible, still the community needs to really try to abide by all of our mitigation measures, the stay home order from the state, trying only to go out for essential activities, and continue to comply with the social distancing, the wearing of the facial coverings or masks, general hygiene measures, try to avoid gathering with non-household members. This is what is going to continue to help us moving forward until we're able to vaccinate a good proportion of our population.
Thank you. And Supervisor Gorin, thanks for that suggestion. I did reach out to them this morning. I'm waiting for them. Thank you.
Okay, with that, I thank you all. I thank our media partners, and I'll turn it back to Supervisor Hopkins.
Thank you so much. And, I actually do have one last question, which comes from the community. This is for Sharon, and I think it's a really important point. So I know we're running late, and I understand if anyone needs to jump off, but Dr. Mace, I'm wondering if you could just clarify the vaccine distribution and how that works. So, the county controls the distribution. Can you explain that process of sort of how a vial arrives and then how it's distributed and who's in charge? I think there's a lot of confusion around that. So if you could just take us through that process and then we can wrap up.
Well, I think I'm going to turn that over to our logistics and operations chief here, vaccine mission manager, Ken Tassif.
Great, thanks. That's a really great question. So we have the amount of vaccine that we know that we have on hand, and projecting forward, we work with our partners to determine who's going to need vaccine in the coming days and week. We process certain paperwork requests for that vaccine, and then we go through a process of pretty complex process of getting the vaccine ready for either the provider to pick up the vaccine with their own coolers, and all that vaccine has to be handled with special data trackers and so on. Moves to the provider. We also have delivery people that can deliver to providers as well. And then there's a third way that happens. For example, with Safeway, who's doing work with us, there is a direct ship program from the state where we allocate a portion of our stock and have the state distribute it directly to Safeway. So there's a number of different ways that it gets there, but it's all very like I say, a lot of complexity in terms of making sure that the vaccine stays viable.
Thank you so much. And I think that's a common point of confusion because it is a complex system. So maybe that's something we can work on getting up on our website, under our FAQs to answer that question. Well, thank you all so much for your time. I especially want to thank our American Sign Language translator, as well as our Spanish translators and all of our panelists for participating. As a reminder, we will have another briefing next Wednesday at 5 p.m. With a panel of experts joining us to talk about equity. I look forward to seeing you all then.